today I'll have a just quick recap about slit lamp examination. So you can, the first figure you can see the binocular eyepieces which provide a stereoscopic vision, and it can be adjusted to accommodate. If you have any kind of refractive error, that also can be adjusted at the eyepiece. There is a ring, focusing ring, okay, so it can be twisted to suit the examiner's refractive error. Then you can see that there are three systems basically, okay, the mechanical system, the illumination system, and the observation system in a slit lamp. So mechanical system is basically starts from the joystick, okay, and the board of the slit lamp, okay, and the parts like the power switch, the illuminator control and all, this falls into the mechanical system. And that basically the instrument actually is the mechanical system. The observation system is how how you observe. An illumination system is basically the system which deals with how the light falls on the object, on the eyes, okay. So the illumination system deals with the light, the observation system is how the observer observes, and the mechanical system is the rest part of the slit lamp, that is the basics, the support of the slit lamp, okay. Now let's go a quick review through the examination techniques. That's a very important thing, okay. There are basically various types of slit lamp examination techniques. Diffuse illumination, you all know. Diffuse illumination, what we do, we basically see the ocular adnexa and we just have a quick look at the ocular adnexa and all the surfaces. Diffuse illumination is also used to see in contact lens fitting, soft contact lens, RGB contact lens, whatever contact lens fitting also we use to see with the help of diffuse illumination, okay. We can see the eyelid margins, eyelashes, everything, just we have a glance with the help of diffuse illumination, okay. And the very important thing is the direct focal illumination. So by this direct focal illumination, why it is called direct? Because the light falls directly on the object to be seen, okay. Suppose you want to see a part of the eye, a part of the cornea, or a part of the eye, anything, so the light falls directly on that part basically. So that is the reason it is called direct focal illumination. It is of three types: the narrow beam, the broad beam, and the conical beam. So narrow beam is a optic section that is used to see all the we have to have a higher magnified view. Basically we use a narrow beam, that is the optic section, okay. We can find out any kind of corneal abnormalities with the help of optic section. We can find the thickness of the cornea with the help of optic section. We can see the anterior chamber depth with the help of optic section, okay. Then comes the broad beam or the parallelopiped beam. Parallelopiped beam basically gives a three-dimensional view of the cornea, okay. So this we use, we can see the epithelium, the endothelium of the cornea, okay, whether it is hazy or not. You can see that through the help of the parallelopiped beam. And conical beam, it's a point-like beam, okay, to see the AC cells and flare. So direct illumination is the most important part of slit lamp illumination. Then comes the indirect illumination. Then comes the retro illumination. Retro illumination can be direct or indirect, that we'll discuss, okay. Then comes specular reflection, sclerotic scatter, oscillatory illumination, tangential illumination, okay. So generally, to observe the eye and adnexa, we use the diffuse illumination, okay. So we can also use the diffuse illumination to see T-but, to do T-but test. We can see the fluorescent pattern. And RGB contact lens fitting, we can see the contact lens fitting also. We can see in soft contact lens fitting also we use the diffuse illumination. So in diffuse illumination, a diffuse wide beam illumination together with the red free or green filter is helpful while viewing the bulbar conjunctiva and episcleral blood vessels. So with the aid of the red free filter, small hemorrhages, aneurysms and engorged vessels stand out well. We can do that with the help of the diffuse illumination. Now let us come to the direct focal illumination. So direct focal beam illumination, you can see here in the picture, you can see, okay, the light source is positioned off to one side and the bright slit beam is shown directly onto the object to be studied. Means you can see the object, that is, suppose there is a foreign body on the cornea, okay. So what we are doing, we are dropping the light beam on the object, okay, focusing the light beam on the object, and the oculars of the slit lamp, that is the observation slit lamp of the observation system of the slit lamp, the focus is also falling on that point. So where the light is falling and the observation system, both are actually in the same focal. So that's the reason we can see the object very clearly. The light is scattered in all directions by the object, and some of this scattered light find its way back to the oculars where it can be observed by the examiner. Okay, so this is basically the direct illumination. So let's discuss about the optic section. Optic section is primarily used to determine the depth or elevation of a defect of the cornea, means how much defect is there in the cornea. Okay, suppose there is a foreign body in the cornea, we can find out by the optic section the depth of the foreign body, how much it had penetrated. Okay, we can also see the conjunctiva or locate the depth of an opacity within the lens of the eye. With the optic section, it is possible to detect corneal thickness, site of foreign body, scars and opacities, the depth of anterior chamber and location of cataracts. We can also see the type of cataract. So once we shown the light on the pupillary border, okay, we can see the lens clearly. If we dilate the eyes, that will be, you can have a very broader view. Okay, you can see the parts of the crystalline lens, and thus you can identify the type of cataract the patient is having. So here in case of optic section, the biomicroscope should be directly in front of the patient's eye. The illumination source is about the 45 degrees and the illumination mirror in click position. The slit width is almost the closed. That is very slight slit width will keep. That is very narrow slit width. The narrowest slit width will keep. That is around 0.5 to 1 millimeter slit width will keep, and the height will be the highest. Okay, so we can set the magnification on low to medium and focus on the patient closed lid. Okay, so this way we can use the optic section. You can see the optic section picture of the optic section here. Okay, how the lens in the figure 3.5b, you can see how the lens is visible with the help of the optic section. Okay, so we can do the Van Herrick's technique to find out the anterior chamber grading. You can see in the AC depth how is it measured. Okay, we'll discuss it later if required. So these are the things we can do it with the help of optic section or the narrow beam. Then comes a parallelopipe beam. Parallelopipe beam, what I have discussed, we can see the three-dimensional surface of the cornea. Here you can see that there are some superficial punctate keratitis. Okay, you can see those marks after those SPKs have resolved. Those marks are there in the cornea. So you can see basically in which layer of the cornea is that those marks are present. Okay, so this is the parallelopipe beam. So for seeing the parallelopipe beam, the biomicroscope should be placed directly in front of the patient's eye in the illumination source about 45 degrees and the illumination mirror in click position. The slit width is around 2 to 4 millimeter. You should remember it is the broadest beam. So 2 to 4 millimeter slit width and variable height can be used. The parallelopipe presents a three-dimensional view of the cornea and the crystalline lens. A three-dimensional view permits observation of the distinguishable details when the crystalline lens zones of discontinuity also we can see. Okay. So what are the findings? See, we see in the case of parallelopipe beam, we can see the tear debris. Okay, we can see the corneal nerves, blood-filled vessels, ghost vessels if it is present it can be seen. If there is a corneal scar, we can see. Okay, so corneal striae is visible. Endothelial pigmentation also we can find out. We can see Krukenberg spindle if it is, we can diagnose if there is Krukenberg spindle. Okay, so this is basically the conical beam or the parallelopipe beam. Okay, now sorry, not the conical beam, the broad beam or the parallelopipe beam. Conical beam actually it's like a point light source. Okay, so here what we do, the observation system and the angle between the observation system and the illumination system can be like varied. Actually 45 degrees to 60 degrees we can keep. The beam height should be it should be a point light like that. Okay, the height and width it is very small. Okay, kept very small, and like once we drop the light on the cornea, and there you will find a blue light and an orange light for the iris. So that blue light and orange light, that point light, that gap between that, it is our anterior chamber, right? In case of conical beam, it is very easy actually to find out whether the anterior chamber is clear or not. If the anterior chamber is hazy, if there is some kind of like the anterior chamber fluid, it is not, the aqueous humor it is not clear, we can find out that. Okay, we can see if there is any like cells present in the anterior chamber, is if there is any flare present in the anterior chamber. Thus it helps us to identify whether any uveitis is present in the patient. To see this one, we basically perform this technique in a dark room. Okay, because dark room, if you see, the contrast will be better, and then you can see the cells and flare. The Tyndall effect you can see if there is cells present in the anterior chamber. So this is about the direct illumination techniques in case of a slit lamp. Okay, so next I'll discuss and the later ones. Thank you.